Breast reduction surgery, if the patients have huge breast and the patient have some pain, neck and shoulder pain, the patient breast must be go to reduction surgery. We are reduct the mass from the breast. This surgery, the patient must have bigger than 18 years old. Before the 18 years old, the patient is very young. If the patient have very big breast, we are speaking with her family and we need psychiatric consultation. After the psychiatry, sometimes we can do this operation to very young lady. But after 18 years old, all the patients, if have very big breast, we can do operation. That the patient have not any serious healthy problem. And before the operation, breast health is very important for us. Before operation, the breast can be controlled with ultrasonography, mammography or breast MRI. If patient's breasts have some mass or very serious disease, we cannot do this operation. This operation can be performed under general anesthesia. Before the operation, we are marking. Generally, I am using inferior pedicle technique and central pedicle technique. The patient breast mass is very big. We are using free nipple technique. Before the operation, I decided which technique is suitable for the patient and I am marking the patient. In the operation, with marking, I can do the operation and decrease the mass of the breast and the areola will elevated and breast can be shaped and decreased. Breast reduction surgery can take 3 to 5 hours. If the breast is very big or huge, it can be take 5 hours. If the breast is not too big, it can be finished 3 hours. After the breast reduction surgery, patient can be stay in the hospital 1 or 2 nights. 1 night generally enough for us. But if the patient is older or if the patient has some general health problem like diabetes or hypertension, these patients can be stay 2 nights in the hospital. Breast reduction surgery have very long incision site. The incision is periareolar area and inferior breast areola, like inverted T pattern. This means there is long incision site and the healing process is longer than breast augmentation. That means nearly 3 weeks later the incision site will healing. But with very big breast, the breast inferior skin is very thin and have some skin problems and healing time can be longer than normal. If everything is okay and we have not any problem after the operation, the final result nearly 3 months later. But some patients have some problem about her skin. Under the breast, the skin have fungal infection and the skin is very thin. That means healing is very problem and the healing will go from 3 months. After the reduction surgery, breastfeeding is some problem because like the patient's breasts have 5 milky glands. We are excised 2 or 3 of these glands. That means milky glands will decrease and so milk produce less or no. If the breast was very huge, we are using free nipple technique. That means free nipple technique is cutting the milk ducts and so the patient cannot produce the milk and the patient cannot give the milk to her baby. And very young lady must be very careful because they will be mom and they cannot give the milk her baby because if the gland less for produce milk, they cannot breastfeeding. If the duct will cut, they cannot give the patient milk. Breast reduction surgery, three kinds of advantage. First advantage is very huge breast results pain, shoulder pain, back pain, and neck pain. After this operation, the patient have not any pain. Second advantage is the breast tissue decreases with this surgery. That means the patient risk of the breast cancer decreases. And the last advantage is the patient social have some benefit because the patient can put on what she wants to. And third advantage is the patient will be free. What she wants to wear, she can.